Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is my Forbes colleague, Alex Knapp. Alex, thanks for coming on.
Thanks for having me.
You cover everything healthcare as well as science for Forbes, so you are the perfect person for this conversation. I want to talk about a string of viruses we've seen break out around the globe. Let's start with the one that's most infamous to us in modern history, COVID-19. We have been seeing an uptick in cases in the United States. Why is that?
Well, there are a few reasons why COVID-19 is seeing a resurgence in what I'm calling our hot virus summer. And one is that in terms of the uptake of booster shots, they've actually been pretty low. So not everyone has been going and getting boosters, even if they've been vaccinated. And your immunity to a virus like the one that causes COVID-19 tends to wane over time for a couple of different reasons. And another key factor here is that there's a new set of variants, which are nicknamed in the community as the flirt variants. But they are not really ones you want to meet at a party. They have a couple of key mutations that actually help evade the antibodies you might have in your system to fight COVID in the first place. So as a result, we've seen an uptick in case numbers, double-digit percentage increases in ER visits for COVID, hospitalizations, and also deaths.
So are these flirt variants particularly dangerous? And are the symptoms the same, those flu-like symptoms of runny nose, coughing, sneezing, body aches, fatigue?
Yeah, they are the same symptoms with the flirt variants. And right now it doesn't appear that it causes more severe cases than previous variants, but because it does evade immunity a little bit, people are more likely to be a little bit sicker if they do get infected. You probably out there have friends who have COVID right now, and it tends to spread in the summer months, especially in the South, because people are congregating in those air-conditioned rooms, especially with the heat waves that we're seeing. But, you know, the vaccines still work, and in fact, the FDA has approved a new generation of vaccines that are more specifically targeted to these variants. And the CDC today, even as we're taping this, is voting on how to recommend the schedule for the booster shots.
So aside from getting those boosters, what else should people be doing to stay safe?
Enjoy the outdoors, breathe in that fresh air. If you do find that you're going to be in a really crowded indoor space, you may have to bite the bullet and start wearing a mask again. N95s still work the best. They're a lot cheaper now than they were during the main line of COVID, or if you're like me and stockpiled them, you probably still have them around the house. And if you feel yourself getting sick, test yourself. The COVID tests are so widely available. And if you do test positive, try to stay away from other people to keep it from spreading.
I do now want to pivot to bird flu. Bird flu is not new. We actually saw a global outbreak similar to COVID-19 back in 2020. But can you explain what it is and how it began?
Sure. So avian flu, there's actually several varieties, but the main one that you'll hear people talking about is one called H5N1. And there's been a global outbreak of a particular strain of this avian flu in wild birds and in poultry that, as you mentioned, started about 4 years ago. But what has happened in the past year is we've seen increasing infections among dairy cattle at farms. And this is of a particular concern because bird flus, as it says in the name, they're adapted for birds. The fact that we're seeing them in mammals makes it more likely that this is a disease that can pass on to humans and could mutate and adapt to spread more quickly and easily among humans. And that's really what has experts concerned about it.
And so what does this do when it is in a bird, when it is in a cow, any type of other livestock? What are the symptoms that they see?
Similar to the symptoms you would have in humans, difficulties with respiration, the cows get snotty, they get cough, you get fevers. Birds have the parallel symptoms with some differences because of the anatomy. And in other mammals, so there was an outbreak among elephant seals in the Arctic that had caught it from eating wild birds. That strain actually mutated to adapt to transmit very easily among elephant seals, and thousands of them have died off. over the past year as a result of those adaptations. And that's the kind of thing we're particularly concerned about happening with people.
In the past few years, we've seen a dramatic rise in egg prices because of the bird flu. So I am curious, what is the economic impact when it comes to both farmers as well as the average American, because this is expanding to different parts of livestock?
Yeah, so it's definitely a huge economic impact. You notice that the price of like turkeys have gone up around Thanksgiving time. Prices of eggs, as you mentioned, and this is in large part because when poultry is infected with the bird flu, they're often culled and quarantined, and so you have fewer chickens available to eat. It's just simple supply and demand. Americans' demand for chicken and turkey is pretty unstoppable. As you have less of it, the price goes up. Just basic econ.
The CDC this year reported multiple cases of humans having bird flu. So is this easily transmissible to humans?
Right now, no, thankfully. It's only in the past year transmitted to 3 people. These were all people who were working on farms with very close contact to animals. And that's where the highest risk is. If you're working on a farm, you're working in a slaughterhouse, and you have really close contact with infected cows, that's your highest risk. Probably the secondary risk, this hasn't happened yet, but it's something that health officials are concerned about, is for that niche community that likes to drink raw milk that hasn't been pasteurized. There is a real concern that could pass on avian flu to humans. It hasn't happened yet, but it's something health officials are keeping an eye out for.
Obviously, livestock, cattle, poultry, they can't mask up like humans can. So how do you stop the spread here?
So the way you usually stop the spread is you quarantine. You want to keep the cattle that are sick away from the rest of the herd. Sometimes they do have to make a cull. If it's so spread out, they'll actually kill all of the infected animals to prevent disease transmission. Other things that can be done are, a lot of testing, and so that you can do more isolation, so you can catch cows that may be spreading it without actually being sick themselves.
I do now want to move on to mpox, which was formerly known as monkeypox. It erupted back in 2022.
Yeah.
It's now spreading throughout the Democratic Republic of Congo. So remind us, what is mpox?
Sure. Mpox is closely related to smallpox, which you may remember is one of the deadliest diseases that human beings have faced. We basically eradicated it in the last century. Mpox is a related disease, but it's still fairly deadly. Not as deadly as smallpox, but still a particularly deadly, debilitating disease. Among humans in that 2022 outbreak that you referred to, that was a strain of smallpox that was spreading primarily as a sexually transmitted disease. And we were able to contain that outbreak through strategic vaccination, through public health campaigns for people to be safer in their activities, and we're able to tamp it down.
You hear it's related to smallpox. That's obviously ringing some alarm bells. So what are the symptoms here, and quantify just how dangerous this is?
Sure. So the new one that's spreading now is a different strain than the one that spread in 2022. And it seems to spread a little bit more easily. So there is some sexual contact related to spread, but it also appears that there's other ways it's spreading as well. And it also appears to be a little bit more dangerous. So the symptoms you get are basically, if you are not weak of stomach, you can Google what smallpox or mpox looks like, but you get pustules kind of all over your body. You get fevers, you get other debilitating symptoms. In the DRC right now, the estimate is that there's about a 5% death rate in adults and about a 10% death rate among children.
We're seeing it in the DRC right now, but is there a risk of a global outbreak?
Yes. The World Health Organization has announced they're very concerned about a global outbreak. They're expanding their efforts to kind of monitor the disease, to try to quarantine people when possible, and to test for the disease. This strain hasn't been detected outside of the DRC yet, but it's very likely that it has already spread outside those borders. And of course, there's also people who travel in and out of the country that may take it back to their home countries if they get infected.
I know if you have chicken pox once as a kid, you don't get it again. Is this the same with mpox where you develop that natural immunity?
Yes, it is. That's a great question. So with mpox, you do develop a natural immunity. If you do get it once, you're very unlikely to get it again. And there are also vaccines available. There is a mpox vaccine specifically that has an emergency use authorization in the United States. So if it were to happen to break out here, we would be able to vaccinate the highest risk populations. And then we also have stockpiles of smallpox vaccine in case the disease ever reemerges. And the smallpox vaccine is actually also effective against the mpox vaccine.
I do want to round off our conversation now with the West Nile virus. You're reporting that it could be making a comeback. So what do we need to know?
Sure. So you may have noticed that it's been really hot this summer. And with that heat and with the humidity and with all that rain comes mosquitoes. And with mosquitoes comes West Nile virus, which has been found in nearly every state in the contiguous United States, with actually some of the highest rates of infection as far north as Illinois. And it is a disease that honestly, 80% of people who get it will probably not know that they had it. But if you're one of the lucky 20%, you will definitely know that you had it. You'll get a fever. You'll get liquid coming out of both ends. You will have rashes, a fatigue, a tiredness that can last for weeks. And in rare cases, about 1 in 150 times, it can actually affect the central nervous system and be fatal.
So why is it coming back earlier than usual? Does it have anything to do with how hot this summer's been?
It definitely has to do with the weather. With the changes in climate that we've seen over the past decade, the United States has gotten hotter, it's gotten humider, and mosquitoes and the diseases they carry are just spreading further and further north, further and further throughout the country, and they're emerging earlier and earlier as the weather's more conducive to their reproductive cycles.
And if you're part of that 80% that is asymptomatic, are you still able to spread it?
Thankfully, no. There's no recorded cases of human-to-human transmission of West Nile. It's really just being the lucky recipient of a mosquito bite.
And what are the effective ways to treat it? Because from what you described, the symptoms don't sound too pleasant.
No. So the best ways to prevent it is if you're going to be outdoors, long sleeve shirts, or if it's too hot for that, spray yourself with bug spray. Just like if you're going hiking or anything else, to just try to, keep the mosquitoes away from you.
Alex Knapp, thank you so much for the conversation. I look forward to our next one.
Great. I'm looking forward to it too. Thank you.